Okay, here we go.
Take a seat for me. Right, I think you spoke to my colleague Dr. Sayer earlier on today, saying you're really low in mood. What's going on?
I don't know, like literally for the past couple of days, I can't leave the bed, like I had to leave work. And I'm suffering from really bad anxiety. As soon as I get into public places, I can't breathe.
Okay. Is this something you've had before?
I used to have really bad depression, like from when I was 17, I got diagnosed with it, but lately it's just coming back. Like I don't want to leave the bed, I can't eat, I'm not.
So nothing's changed in life or nothing new, it's just...
It's literally, I woke up and I didn't want to leave the bed. I feel like I'm scared of something, but I don't know what I'm scared of.
Are you taking anything for it?
I stopped taking them ages ago, but I don't know what triggered it or what's sort of going on.
All right, well, we need to sort this out here. Why don't we give you a bit of time off work so that way you don't have to keep
I'm just worried because obviously I'm new to there and I don't want it to be a thing where they fire me, but I literally can't, like, earlier on when I called in, I literally felt like everything was about to fall on me. My chest got tight and I had to literally like strip myself in the bathroom because I didn't know what was going on. Like I felt like the walls were sort of caving in on me, and I've never had anxiety. I've never ever suffered with it. It's never happened to me before.
Have you got anyone at home with you?
I live with my nan, but it's like I don't want to stress her because she forgets things anyway, so it's really bad.
We'll sort this out. It's all right. We'll sort this out. With regards to work, I don't know what you'd prefer because you can take self-certified for 5 days. That way you can say whatever you want to say.
Well, like, I might need a few days just to gather myself. And it's something that's documented that I've struggled with for years. But right now I'm scared that it's only going to get worse.
Okay. All right.
When I was younger, I would literally lock myself in the bathroom and they would have to call, like, the police and stuff to come and get me out. And I don't want to go back.
We won't go back to that. We won't. It's all right. We're not going to go back to that. We're going to sort this out, all right? Sounds like we need to start you back on something again, and maybe get you in touch with some counselling again. Have you had counselling in the past, yeah? Okay, well look, most people have started on either sertraline or citalopram.
That's the one I had before.
Would you like to try that one again, or would you like to try something different?
I think I might want to try something, only because when I started on that, it's like it got worse before it got better, and it wasn't.
Yeah, it can, just warning you, all of them generally make things a little bit worse to start with, but let's try the new one anyway. But just to warn you though, those first 2 weeks generally make you feel a bit more rubbish. There are other things like propranolol and diazepam that you can kind of take if you're getting a bad panic attack. Problem with diazepam is it is addictive in nature, so it's the kind of thing we can only really give you kind of a few tablets of. Or there's propranolol, which helps like slow down your heart rate and stops that whole like fluttering thing. They're not addictive necessarily, but it's not something you want to be on long term. It's just maybe might help at the moment whilst you're feeling so panicky. Would you like to try either of those? Yeah. Do you have a preference of which one, or you're happy to give either one a go? Okay, let's try propranolol as well. Oh, have you got asthma?
Yeah.
I just wonder because propranolol, it can sometimes make asthma a bit worse, and so I don't really want to give it to you if your asthma might get triggered off, so I'm not going to use that one. All right, if I give you 7 tablets of the diazepam, I said they can be addictive, so please just be careful. I only take it if it's really bad. Okay. Now I'm going to just give you a telephone number to get counselling as well, okay? All right, so give them a call as soon as possible. And come see me again in 2 weeks, having started all of this. Obviously, if things get worse in the meantime, just call us, okay, like you did today. If things don't improve, just give me a call.
Perfect, thank you so much.
That's all right. Good luck with all, okay? Let us know how it goes.
My asthma's been quite bad recently.
Barely breathe, just really tight chest.
And then, all of a sudden, I start to cough. I was short of breath.
I felt like my whole chest was like a balloon that I just had too much air in. I couldn't get it out.
So it just like, instantly I'm just like, I can't breathe.
So your asthma is not good?
No, it doesn't feel too great. I just feel really kind of just tight.
You sound terrible. How long have you been like this for?
It was bad last week, and it felt a bit better. And then probably, I think, Friday last week, it felt not so good. And
How many puffs have you had today?
About 6.
Okay, I'm going to get you a nebuliser now so that we can talk a bit more, okay? I might need to come and sit here, so you're next to the... I can plug this in. All right, when ready, I'm just going to plug it in for you. You feel it coming? Okay, so just some nice deep breaths for me, okay? How long have you been breathing this fast for? Today and is today? I think we're probably going to need to send you in because we're not winning. You're at that point now where potentially you could get so exhausted that you'd find it hard to breathe at all. I'm going to get reception to call an ambulance, all right? Just going to have the door open, just in case you need us. Can we get an ambulance now? Blue lights, yes, please.
For now?
Yep.
What's wrong with them?
Room 6, severe asthma attack.
Severe asthma attack.
She's got respiratory rate of 60 despite a nebuliser tell them, so they need to come in now. If someone comes in an emergency situation, the sort of human instinct is to panic, but this is what we're trained for. And I have worked in A&E, and we are GPs, we are very highly skilled. So although it doesn't happen as often in general practice, it still happens frequently. So your adrenaline is pumping, but you don't panic. You need to stay calm because you need to assess the situation, work out what needs to be done immediately, because there's lots of jobs to be done and it needs to be done quickly, but safely and calmly.
Speaking, how can I help?
What's your date of birth, please?
Vicky speaking, how can I help?
She's on 40 milligrams of prednisolone, has been for 7 days, and things have got worse rather than better. So we're back at our limit again for what we can do in the community. Thanks ever so much. Okay, bye-bye. Bye-bye. Hi. All right, lovey. Hi. So this is Miss Gorey, who's a known brittle asthmatic. She's normally on 10 milligrams of prednisolone every day, but she's been on 40 milligrams for 7 days, despite which we haven't really got on top, as you can see. So this is after a 5 milligram nebuliser. She's still got a respiratory rate of 60. All right, I hope he gets better soon. Okay. Thanks, guys.
No worries.
Thank you. All right, thank you, guys. Good luck. Take care. Poor love, she's just breathing so she's terrible, so fast. Really frightens me when they're that bad, because, anyway, poor love. Relief in one sense, when the door closes and the patient's gone with the ambulance crew, they're safe, they're going to hospital, that's what needs to happen. Sometimes a sense of kind of, not anticlimax, but almost, because you've had this adrenaline, everyone's been rushing around, we've looked after the patients to the best of our ability, and now they're in someone else's care. But actually, you then have to take a deep breath and realise that probably you're running late, because this has taken, understandably, way more than 10 minutes, potentially 20, 30, 40 minutes. So then you kind of take a deep breath and have to face the day explaining to everyone. Hopefully, most patients understand, but it can be quite stressful then.